You know, the stories we've heard today have been incredibly compelling, personal and family tragedies. And stories like these just really shouldn't happen in the state of Minnesota to Minnesotans. You know, as I was sitting here, I was imagining what it would be like to have to face the kind of choices that these nurses and families have had to face because of these staffing issues, and I don't think any one of us would want to be in that circumstance. You know, at the end of the day, we talk a lot about healthcare reform, but what it really is about is one simple thing, and that is when a Minnesotan gets sick or faces a healthcare emergency, that they get the kind of high-quality professional care that every one of us would expect from people that have the resources to provide that kind of care. And by proper care, I don't just mean the medical procedures, the technical medical procedures that they get and should get, but truly care. That's kind of the personal attention that really aids in healing and treats everybody with the human dignity that everybody in this state deserves. And the stories that we've heard today, and then if you've looked at the Facebook page or other places, you'll see those stories tell us that that kind of care isn't happening everywhere in Minnesota today. And that's unacceptable, and as Minnesotans, we do need to act to affect and change that. And so there's really 3 points, quick points that I want to make today. And the first one is this. That is talking to nurses and talking to others. It's very clear that addressing concerns about safe patient care and staffing is a fundamental part of this negotiation. This negotiation isn't just about wages and benefits and hours, but it's about making sure that all Minnesotans get the kind of care that they need and deserve every time they show up at a hospital. That is what these negotiations are about, and really nothing else. And it's important that the hospitals hear that message. The second thing is that there is clearly more than meets the eye when we look at the hospital's positions on staffing. And I say that as someone who's been serving in the legislature and dealing with efforts to gain simple transparency and reporting about the impact of staffing on events, patient safety events that happen in hospitals. And hospitals have been fighting fiercely to avoid even looking at reporting and transparencies of that connection. And you have to ask yourself, if they are so fiercely opposed to just the simple fact of transparency, what else is going on there? And I think that question, that issue raises the fundamental question here, is that there is something going on here that the hospitals really don't want to talk about in a meaningful way, and we need to do that. And the last thing that I just want to say is that instituting some fair, effective, and workable standards and expectations around staffing is a matter that is best resolved around the negotiating table between the nurses and the hospitals, the people that know best, that are in the trenches doing this all the time. They are in the best position to come up with the right solution here. But if that best option doesn't work, you know, the legislature, who has been standing on the sidelines, is ready and willing to step in and is prepared to act and establish some of these standards in law if we need to go there. And not only that, I think that we're obligated to do that if we can't reach this resolution, because as the stories you've heard today, that kind of thing happening in Minnesota simply isn't acceptable. So I'm really here today to encourage the hospitals to come to the table in a meaningful way, address the staffing and safe patient issues so that the folks that know best how to do that are doing it. But if that doesn't happen, we are going to have to take this up again at the legislature and come up with a